Hi, Dr. Adhar from XSculpt. I'm making this video to talk about post-surgery exercise after your gynecomastia surgery. Okay, so if you've had surgery with us, congratulations. This video is for you guys, our XSculpt patients. Now, if you did not have surgery with us, I cannot recommend our post-operative workout program for you because I don't know what your specific doctor wants or your specific doctor requires, and technically speaking, depending upon their technique or their technique or how they did the surgery, post surgery exercise may actually be harmful. So this, again, I stress, this is only for XSculpt patients, and if you had gynecomastia surgery with another surgeon, you can listen. I'm happy that you're here, and I'm happy that you're listening, but I cannot recommend this program for you. You would have to ask your surgeon what would be the best best program for you based on the surgery that you had. Okay, so now post-operative exercise for gynecomastia with us. There are as you know, when you woke up after your surgery, you were wearing the compression vest with the foam and all that stuff. And now that your compression vest is off, or will be off soon, it's important to really enhance your surgery, the results of your surgery with post-operative exercise. Now, we do our procedure in such a way to really try to bring out the cuts in the lateral aspect of your pectoralis major muscle as well as the inferior portion. And so the post-operative exercise that you do will really help enhance that look. Okay, so basically it's 4 exercises that I want you to concentrate on. Okay, upper incline chest pressing is the first one. Okay, barbell or dumbbell. Second is pectoral flies. Okay, pectoral flies. The third one is lateral pull downs or pull-ups, and fourth is any type of row, cable, like a cable row or bent over row with dumbbells or barbells. Okay, and there is a reason for this. What these exercises will do, it does help. It will help with your skin contraction, and it will also help with scar formation and breakdown to become customized to your body, and also obviously it helps build up the musculature to enhance. It builds up the musculature to enhance the results from your surgery. Okay, so by doing incline chest pressing, it will bring your skin, upward and build your upper chest. Okay, to enhance that armor plate look, as well as the pectoralis muscle. The pectoralis muscle will help develop the middle chest. It'll also help skin contraction, bring it up in medial. Okay, we do liposuction, on the sides here, so we want you to do lateral pull downs to enhance your latissimus, to create that look of the negative space, and it does help bring the skin that we contract back more, as well as the bent over rows. When you do bent over rows, it'll fix your posture, number one, which will help bring your chest out, number one. Number two, it will also bring that skin back to really kind of, like, if you can see, it'll like enhance the look of your chest, especially bring down the skin here to bring it back. And those 4 exercises will help do it. Now the question is, now we come to the questions: how much weight should I be doing? So you should be doing a hypertrophy type program because basically what we want you to do is build muscle. So essentially you want to do, probably somewhere between, 6, 7 to 10 reps per set. And that 10th rep should be, somewhat difficult for you to reach. And then, as the weight gets easier to do, you increase the weights, progressive overload. And now the question is how many sets, and this gets controversial. However, what I like is high frequency training, which is you can look that up, but high frequency training is it's been around, but its popularity is relatively recent, and basically what the research shows is if you do a muscle group more frequently during the week, even though you do not as many sets per day, the amount of hypertrophy and strength is vastly more than if you were to, just do it on one day. So for example, let's say you do you're a guy who does chest on Monday, and you do 15 sets for just your chest on Monday, and you don't work out chest until next Monday, okay? So research has shown it's better to split that up. So instead of doing 15 sets on Monday, you do, let's say 4 sets on Monday, 4 sets on Wednesday, 4 sets on Friday, and 4 sets on Saturday or Sunday, or you do, 3 sets each day for 5 days straight, for a total of 15 sets in the week. So you're doing it much more often, you're hitting chest much more often, but you're just doing less sets. But your overall volume during the week is the same if you were to do it on Monday. So, and the research supports this. So what I like to recommend is 4 sets of incline, 4 sets of pec fly, 4 sets of pull downs, and 4 sets of rows 5 days a week. And then after you finish those, that core workout, then afterwards you can do whatever else you want. You can do legs, stomach, arms, whatever. But at least try to hit 5 days a week, 4 sets each of those exercises at a moderate weight of 6 to 10 reps per set. And by doing these exercises, and granted you're eating on point, because the exercise, you can exercise as much as you want. If your diet's not on point, it's not going to help at all, or it'll help minimally. So, if you can hit at least 1 gram per pound of protein, 1 gram of protein per pound, because you want to grow your muscles at this point. I don't want you to cut so much. So at least to either, you have to get your calories in, because if you're in a calorie deficit, you might not grow, and I kind of want you to grow a little bit, at least at this point. You can do whatever you want, but it will look much better if you grow, at least for the 3 months, the first 3 months, because after the 3 months, then we can talk about doing a cut or whatever. But at least until your 3-month visit, I'd like you to do this exercise and eat a lot of calories, a reasonable amount, healthy calories, to grow your chest, and so we can really enhance that look. Okay, so basically that's about it. If you have any questions, you can always, if you're one of my patients, you can text me at any time, or you can email me at dr.adhajar@xsculpt.com, or visit our website and submit a virtual consult to come visit us. Yeah, all right. Thank you so much for listening, and hope you watch one of our other videos. Thanks a lot.